Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. San Diego nearly slipped into a more restrictive COVID-19 reopening tier this week. More on that in a moment, but first, the latest numbers show more than 66,000 cases in San Diego and Imperial counties since March. And this week, the region reached 1,200 deaths. Coming up later, we'll look at the new guidance for theme parks and the cancellation of the Holiday Bowl. But first, Taryn Mento on how San Diego is barely staying in the red reopening tier.
Just 2 miscounted cases. That's how close San Diego County came to a case rate that could have put us on a path to a more restrictive stage of reopening.
What we determined is that the calculations that the state originally prepared included 2 cases from a particular federal prison.
Public health officer Dr. Wilma Wooten says the state does not include those cases in its weekly case rate assessments that come out on Tuesdays.
Those 2 cases were removed, and that is what resulted in San Diego County going from purple to the red tier.
The change put San Diego's case rate at 7 per 100,000 residents, just below the threshold the state considers too high. If San Diego reaches a case rate over 7 for 2 consecutive weeks, it could trigger restrictions on businesses. Wooten warned San Diegans that individual actions can be the tipping point.
The county can just do so much. It really is going to require every individual, every business, every other sector to do their role. So as individuals go to various businesses, ensuring that their patrons wear their facial coverings and social distance. For various businesses where groups gather, not allowing people to gather at the bar or to gather in large groups or to have parties, or it just, again, everyone has to do their part.
But even as officials warn of a climbing case rate, it wouldn't affect any Election Day operations on November 3rd. County Registrar of Voters Michael Vu says they're prepared to keep voters safe in any case.
Voters who fail or mistakenly forgets to bring a mask will be offered masks. They will also be offered gloves should they wish to use gloves as well.
There will also be sanitizing stations, and poll workers will be disinfecting surfaces. They're also consolidating voting centers into larger spaces to accommodate social distancing, and they're keeping them open for 4 days. Taryn Mento, KPBS News.
Nearly 900 people have died as a result of COVID-19 in San Diego County, but that official tally might not tell the full story. A new analysis from our partners at iNewsSource found the death toll is significantly higher. iNewsSource investigative reporter Mary Plummer explains.
Lakeside resident Rosie Sanchez died in August at age 81 of post-polio syndrome. Her daughter, Becky McBride, says the pandemic is also to blame. Sanchez relied on daily exercise to stay strong, but when California's stay-at-home orders changed her routine, her health quickly went downhill.
It got so bad at the end because she had no muscle that she couldn't sit in the car because she would sway so much when I would go around corners. She lost all her core muscle, all her muscle in her arm, and was not able to walk or stand.
Her decline landed her in the hospital. She spent a few days at home in hospice before she died. Sanchez is among more than 1,000 county residents who fall into a category researchers call excess deaths. It measures how many more deaths have occurred during the pandemic than you'd expect to see in a normal year. That means it captures all kinds of people who died from the pandemic, including some who had COVID-19 infections but were never tested, while the county's official pandemic death toll only includes people with positive tests. Excess death rates also include people like Sanchez who were never infected but whose lives were cut short. Her daughter tears up at the memories. She says if not for the pandemic, her mom would still be here.
I guess I just wish we could have lived our lives and made our own choices. Because instead we're being told, I have sores on my face from wearing a mask 8 hours a day. And I can't really do a funeral. I can't really do what I want to do for her. And I'm just thinking, this is all so unnatural.
Sanchez's death has gone uncounted until now. A county spokesperson questioned our reporting, calling the analysis premature. We spoke to 8 epidemiologists who disagreed. For KPBS, I'm iNews Source investigative reporter Mary Plummer.
And Jill Castellano co-reported this story. iNews Source is an independently funded nonprofit partner of KPBS. Now to the ongoing challenge for parents, teachers, and students. North County is taking a step forward with Vista Unified starting in-person learning for all grade levels in the district. Teachers and parents recently rallied against the reopening plan before a school board meeting. They say the district has not provided enough protective equipment to prevent the spread of COVID-19. District officials say they've spent millions on PPE.
The problem is that it's just not equitable throughout the district. What some classrooms have, other classrooms don't have, and we just want the safety the same for all of our members and all of our students.
While kids are back at school, not all of the learning is happening indoors. The district shared these photos from Vista Academy, where some classes are being held outdoors to allow for social distancing. San Diego Unified is bringing back about 10% of students for in-person learning, but that move won't help the vast majority of kids still trying to learn from home. KPBS reporter Claire Tregesser checks back in with kids in remote kindergarten.
Is your class in?
It's very quiet in the Ramos household as 4 kids sit and work on their laptops. The living room has been completely remade into a classroom. There are word cards on the floor, charts on the walls, and a giant timer to help the kids stay on schedule. It smells like warm muffins, and pretty soon, the kids stop to take a snack break.
What's a good word that starts with a J?
Jelly bean.
Oh, yeah.
2 families are in this learning pod. They've paid a private tutor $2,500 a month to guide their kids through online lessons each day, plus come up with extra activities. She moves between the kids to see if they need help.
The first day, the kindergartners, their face was just like, what's going on? Like, actually, one of them was even like on the verge of tears.
There are 2 kindergartners in this learning pod, and Horace says they especially need her help. They've never been in school before and are learning to read, follow a teacher's instructions, even do gym class.
Opposite right elbow, left knee.
All remotely.
Reading workshop, writing workshop. They have kind of a checklist of independent activities they have to do every day.
That's true across the school district, but for families without extra help, it's really difficult to handle.
When we first started the Zoom classes, it was a disaster.
Dania Hernandez's daughter, Jasmine, is in kindergarten in North Park. She can't work from home, so her plan was to have her mother help Jasmine with online school.
You know, there was times where my mom was telling Jasmine to sit down and just pay attention to the teacher, and she was like, no, but the teacher is telling me to stand up.
So then Hernandez brought in her cousin, who takes night classes in college, to help guide Jasmine. It's better, but there's still lots of issues.
She had a couple fits because she was like, I know the answer, but there's too many kids.
Hernandez is worried about her daughter being so stressed out, but also about her falling behind.
I thought about just pulling her out. I'm just like, okay, maybe I just pulled her out. But then at the same time, I'm thinking, no, maybe just a little bit that she's getting, it is helping her.
Across the district, kindergarten enrollment is way down. There ended up being about 2,500 fewer students than expected, and 2/3 of that drop were kindergartners.
In some cases, we think parents are making a conscious decision to not enroll their students. But we think that there are other cases where, parents just might not be clear about the process.
Richard Barrera is vice president of the San Diego Unified School Board. He says the district is trying to find families of kindergarten students to get them signed up.
That's a challenge because if a student is not in our database right now because they've never, been enrolled in our district, we might not actually know who they are.
Getting students enrolled in school may benefit them, but it won't fix the huge inequities online learning is creating. While some parents like Hernandez are thankful if their kindergartners can just get a little learning, that something is better than nothing, others are launching ahead in their kindergarten curriculum.
And I feel like Maya and Kaya are learning to read.
Yeah. Nicole Ramos is one of the moms in the learning pod we visited. She says, all things considered, it's going really well.
The kids every morning wake up and they're excited for school. They're excited to see their friends, and to get to learn next to them and have their breaks together and find those moments to just connect and play.
In fact, even if her kids' school reopened, she's not sure she would want to send them back because she doesn't want to disrupt the routine they've established. Claire Tregesser, KPBS News.
COVID-19 is tied into so many decisions we're making in this election. The pandemic has also exposed weaknesses in our social safety net. As San Diegans cast their ballots, one of the questions facing them is Measure A. Andrew Bowen tells us about the plan for more affordable housing and who is being asked to pay for it.
At the corner of Twain and Fairmount Avenues in Grantville sit 79 apartments housing the formerly homeless. The complex, called Stella, opened in December of last year. Residents pay deeply subsidized rents and have on-site services to help them live healthier lives. Stephen Russell, president and CEO of the San Diego Housing Federation, says San Diego needs more of this, a lot more.
Well, we have been absolutely heartbroken over the fate of folks who are living in the streets of San Diego. We've seen what a terrible cost it is to them, to their health, to our common health, to the quality of our neighborhoods. We believe that we have an opportunity now to resolve that.
Russell says the $900 million in bonds that Measure A would raise could fund construction of 7,500 affordable homes for the chronically homeless and those at risk of becoming homeless.
We want to create a safety net for seniors, veterans, people living with disabilities, and youth who are transitioning out of foster care so that they would not be at risk of homelessness. They're disproportionately homeless in terms of the populations as a whole.
Russell adds that the local money could be matched 3 to 4 times over with state and federal subsidies, which could work as a local stimulus program as the region recovers from the pandemic.
We believe that as a property tax, it spreads so thin over so many people that it's relatively modest, and that it really provides an opportunity for us to create a safety net that is so clearly lacking as we saw during this pandemic.
Measure A would be paid back with an increase to property taxes, and how much you pay depends on the assessed value of your home. For every $100,000, you'd pay about $3 extra in the first year. So say the county assesses your home's value at $600,000. In year one, you'd pay about an extra $1.50 per month. That would gradually increase to about $10.50 per month by the end of the decade. If you're a renter, some of those costs may be passed on to you.
You keep giving the bureaucracy more money to spend, they're never going to have any incentive to implement those reforms and regulations.
City Council member Scott Sherman is voting no on Measure A. He points out that with interest, the measure would cost $2.1 billion over 46 years. He says building affordable housing is too expensive and that the government should focus on lowering the cost of construction before raising taxes.
Politicians told you, oh, it's just a small little bit of tax. It won't amount to much. It's not that much out of your budget. Well, if you keep doing that time and time again, it finally adds up to where now it's almost half the cost of building housing in this city.
Sherman is referring to a 2015 study from Point Loma Nazarene University that found regulations account for up to 47% of the cost of housing in San Diego. With subsidized affordable housing, Sherman says the state should end the requirement to pay construction workers higher wages, called prevailing wage,
which by everybody's account ups the cost of those units by 20 to 25%. I'd much rather get that done without prevailing wage, save that 20%, and build more units with that money.
Measure A has been endorsed by the County Democratic Party, affordable housing builders, and organizations that serve the homeless. It also won support from the San Diego County Taxpayers Association, the Associated General Contractors San Diego, and the Building Industry Association of San Diego County. It's opposed by the County Republican Party, the San Diego Union Tribune editorial board, 3 city council members, and conservative radio host Carl DeMaio. Measure A needs a 2/3 majority from city voters to pass. Andrew Bowen, KPBS News.
Early voting continues all the way through Election Day, which is November 3rd. You can review all of the races and ballot measures in your area with the KPBS Voter Guide. Just click on the Voter Guide link that you'll find on our homepage, kpbs.org. With local coronavirus case rates rising, local health officials are pushing the state to consider other data points like hospital capacity to help loosen restrictions. KPBS health reporter Taryn Mento looks into it in our ongoing series about the county's COVID data.
The sound of the ICU at Sharp Chula Vista Medical Center carries all the way to the elevator.
So our ICU looks very different.
Danisha Jenkins heads the unit. They recently added noisy but crucial negative pressure systems to every patient room.
Prior to COVID, we only had 3 negative pressure rooms in our intensive care units.
The suction system keeps contagions from seeping into the hallway.
Now we've converted every single room up here to negative pressure.
The sound earned it a nickname, the spaceship. It now allows the hospital to safely host COVID patients in any of its ICU beds. San Diego County closely tracks that resource to reveal any extra stress from the pandemic. Governor Gavin Newsom relies on a data-driven process that controls limitations statewide. But a county system uses 13 metrics to drive local decisions that could further restrict activities in San Diego. A KPBS review of the county's process revealed local government and healthcare leaders don't always agree on how to count crucial resources, like ICU beds.
Pretty much with every patient interaction, there's some clinician putting something in the computer.
Back in Jenkins's office, her computer screen shows a system that logs the status of every bed.
They're blocked for one reason or another. They're dirty. Tells us if it has a patient going into it or going out of it.
But early in the pandemic, capacity got so tight they transferred patients to other Sharp hospitals. Nurses from UC San Diego even delivered baskets of snacks to keep up the Sharp team's energy.
The nursing community, especially during these times, is strong and powerful.
The county wants at least 20% of the region's ICU beds to be open, or it may consider new restrictions to limit community spread of the virus. The county tallies empty, clean beds as available, and that capacity hasn't dipped below 27%. But Jenkins says there's another, more realistic way to count beds.
And this is the number of staffed ICU beds that we have available.
Sharp's spaceship may have 40 unoccupied beds, but Jenkins says they may only have enough nurses for 30. That means what the county considers available may not always be ready to take patients right away.
If a hospital has 300 licensed beds, that doesn't mean at any given point they're staffed fully for 300 beds.
Dimitrios Alexio heads the region's hospital association. He says hospitals would have to add shifts and temporary workers to close the gap between open and staffed beds. But it is a familiar strategy.
So if we got to the point where we didn't have beds available, we would continue to work to find staff. It's what always happens.
The county wouldn't agree to an interview, but a spokeswoman says health officials don't focus on staffed beds because it will, quote, always look like the hospitals are almost out. She says the number, quote, doesn't accurately account for their ability to rapidly increase capacity and staff. At Sharp Chula Vista, the surge has subsided for now, but flu season is nearing and reminders of the influx that could come again are all around. Pictures from children calling them heroes hang at the nurses' station. Brown grocery bags of staff protective gear fills their former conference room.
Everyone's equipment that keeps them safe. It's kind of crazy looking in there.
The county's metrics also track safety gear to make sure hospitals aren't running out. Yet some hospitals don't think they tally enough items.
You guys doing okay?
But for Sharp Chula Vista, the biggest mark from COVID is the ache left from losing one of their own. Jenkins and lead ICU nurse Eloisa Salinas embraced as they remembered Sharp's longtime facilities manager.
I had known this person for a long time, and I know the family for a long time. And now it was the end of life for this person, and it was heartbreaking.
51-year-old Raul Romo, a new grandfather who painted his beard pink for breast cancer awareness and played Santa at Christmas, died at the hospital in May after contracting COVID.
The numbers are people, right? And some of them were our people.
Romo helped build the spaceship. Taryn Mento, KPBS News.
And COVID-19 has taken another big event away from San Diego. The Holiday Bowl will not be held this year. Organizers blame the effects of the pandemic. The game has been a December tradition in San Diego since the late 70s and would have featured teams from the ACC and Pac-12 conferences. If it returns in 2021, the Holiday Bowl will likely be played at Petco Park as work continues on a new Mission Valley stadium. Arts and entertainment are suffering during the pandemic. This week, the state announced new guidelines for theme parks. But as Matt Hoffman tells us, attractions big and small say the new rules won't help them fully reopen anytime soon.
We are all united in trying to get back to work in a safe and responsible way.
Leaders of California's biggest theme parks, including Disneyland Resort, Universal Studios, Knott's Berry Farm, and Legoland in Carlsbad, are pushing back against new reopening guidelines that they say will only keep amusement parks closed.
We've seen all other 7 other Legoland parks around the world reopen safely with millions of guests and around 20,000 employees.
State health officials recently toured open theme parks in other parts of the country, and they were impressed by how lines were managed and the ability to space groups apart. But they still had concerns, especially with tourists.
People may keep their guard up while they're in let's say, a theme park, but when they are milling around the community, their guard may go down, and that could be just enough to create outbreaks and transmission risks that California just doesn't want to see.
Theme park leaders say many visitors to their parks in other states during the pandemic are actually locals, and they feel like state officials just aren't listening.
Not taking into account, at least from our perspective, any of the things that they saw other than, what they're most concerned about.
And I think it shouldn't go without mentioning the impact on our area and on the community in which we're an enormous part of. We're the biggest employer here in Carlsbad, and further extension of closure is just not acceptable.
Under new rules, large theme parks can only open in counties that have reached the state's least restrictive reopening tier of yellow. But San Diego County has been hovering near the state's most restrictive tier.
It really weighs to feel like, your state officials are okay with jobs being lost at an alarming level.
Under new guidelines, Belmont Park in Mission Beach is considered a small theme park and can reopen rides if San Diego reaches the second less restrictive reopening tier.
While we're that step above the big parks, it's still a bit deflating for the team, because they look at the numbers and they realize how far off that is.
While the famous roller coaster is shut down and the arcade, the nearly 100-year-old park has adapted with some new outdoor attractions, but
it's not sustainable. It's really tough.
Legoland has its hotel, aquarium, and a couple of other attractions open just on a limited basis. While SeaWorld San Diego has been approved to open under guidance for museums and zoos, they're currently running their Halloween-themed spooktacular on the weekends. A spokeswoman for the California Attractions and Parks Association says negotiations to reopen theme parks will continue, and in terms of possible legal action, all options are on the table. Matt Hoffman, KPBS News.
The San Diego Asian Film Festival begins this weekend with a mix of video on demand, online discussions, outdoor venues, and Twitch live streams. KPBS arts reporter Beth Accomando previews the festival with its artistic director, Brian Hu.
The coronavirus pandemic forced the San Diego Asian Film Festival to rethink how it would be showcasing films this year. So it's only appropriate that its opening film is all about COVID, says artistic director Brian Hu.
It's a miracle that this movie exists. So the film is 76 days. It takes place completely in hospitals in Wuhan during the 76 days in which the city was shut down. And how these healthcare providers are really making this up as they go along. And their solutions are incredibly powerful and show the persistence of the human spirit and the drive towards healing.
76 Days will stream online, but Be Water, a documentary about Bruce Lee, will screen at a pop-up drive-in.
Now, Bruce, just look right into the camera lens right here and tell us your name.
My last name is Lee, Bruce Lee.
The film provides not just an insightful portrait of the Hong Kong superstar, but also a revealing look at what life in America was like for an Asian in the 1960s and 70s. The second drive-in feature is a horror comedy, Get the Hell Out, which takes the raucous antics of Taiwan's parliament and just adds zombies. A very different Taiwan is featured in The Husband's Secret, a 1960 film that has just been restored.
when I watched it, I was shocked by just how modern it felt. The way that they talk about sex and adultery, it just feels so alive and contemporary.
The Philippines is represented by Gina's Pan, another epic melodrama by Lav Diaz.
They're very slow, they're always in black and white. But what happens is, as you just watch for extended amounts of time, you become lulled into this false sense of security. You enter the Lav Diaz wavelength, and then once he has you locked in, he knows he can do anything to you, including unleashing just unexpected brutality and ways of looking at the behavior of human beings as they're taken to the limits of morality.
Asian pop assaults your senses with a wushu-style Chinese martial arts film called Wild Swords, and with the exuberant passions of anime fans in Project Dreams, How to Build Mazinger Z's Hangar. The film I'm most looking forward to is the latest by Hong Kong's iconoclastic director, Johnny To.
So he hasn't made a film in a few years. And then last year he drops Chasing Dream, which is a mix of mixed martial arts, hot pot entrepreneur movie, a gangster movie, as well as a singing competition movie.
The festival closes with Riz Ahmed in Mogul Mowgli.
And it turns out Riz Ahmed is actually a incredible rapper. So part of the joy is watching him perform.
Once again, the San Diego Asian Film Festival serves up a dazzling assortment of cinematic treats. Beth Accomando, KPBS News.
And that's all for this special edition of KPBS News. For all of us here at KPBS, I'm Maya Trabulsi. Thank you for joining us, and stay safe.